Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I am currently completing my placement with the Organization for a Safer Space. Today, I will be talking about bipolar disorder. In this video, we'll first look at what bipolar disorder is, the types of bipolar disorders, statistics, risk factors and causes, signs and symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Emotional mood swings are normal, but for some people, mood swings can be extreme. Bipolar disorder, formerly called manic depression or manic depressive illness, is a lifelong mood disorder characterized by extreme changes in mood, energy, thought, and behavioral patterns. Bipolar disorder can be chronic or episodic. These changes can last for hours to months and affects everyday functioning. There are 3 states of bipolar disorder: a high state, referred to as the manic phase, a low state, also called the depressive phase, and a well state, which involves normal functioning. There are 4 types of bipolar disorders. The first type is bipolar 1 disorder, which is the most severe type. People diagnosed with bipolar 1 disorder tend to have at least one manic episode that typically lasts for at least 1 week, a previous depressive episode that typically lasts for at least 2 weeks. However, both of these types of episodes can last for months. The second type is bipolar 2 disorder. People diagnosed with bipolar 2 disorder must have had one or more depressive episodes. Chronic depression is more common in this type of bipolar disorder. At least one hypomanic episode, which is a form of mania that is less severe, shorter, and has less effect on everyday functioning. The third type is cyclothymic disorder, which involves a cycle of constant and quick shifts from hypomanic episodes to depressive episodes for at least 2 years, with brief occurrences of a normal mood that generally lasts less than 8 weeks. The last type is other specified or unspecified bipolar disorder. This is relevant for people who experience significant mood changes but do not meet the criteria of the other 3 types of bipolar disorders. Statistics. Bipolar disorder affects around 5.7 million adults in the United States, which equates to 2.6% of the country's population. In Canada, approximately 2.2% of people will experience bipolar disorder in their lives. The age of onset is 25, however, it can begin as early as childhood. It affects males and females both equally in numbers. However, the effects may be different. For example, females may experience more depressive episodes than males. Risk factors. Scientists are uncertain of the exact cause of bipolar disorder. However, they believe there are certain risk factors that contribute to the development of bipolar disorder, including genetics. There is an increased risk of developing bipolar disorder if a parent has the disorder as well. 2/3 of people with bipolar disorder have at least one biological relative who has bipolar disorder. However, inheriting the disorder from a relative is not absolute. Environment. Stressful life events such as a family death, illness, relationship issues, or financial issues can trigger manic or depressive episodes. Stress and trauma and how one handles it can increase the chances of developing the disorder. Brain structure. Researchers have identified differences in the brain size or brain structure activation in people with this disorder. Signs and symptoms. People with bipolar disorder can have both manic or hypomanic episodes and depressive episodes, or a mix of manic and depressive episodes. During a manic episode, a person with bipolar disorder can experience any of the following symptoms for at least 1 week: extreme happiness and excitement, extreme irritability, abrupt and serious mood changes, racing thoughts, rapid speech, increased energy, less need for sleep, increased self-esteem, hallucinations and delusions, extreme appetite for food, alcohol, or sex, reckless behavior, and poor judgment. During a depressive episode, a person can experience the following symptoms for at least 2 weeks: sadness, loss of interest in pleasurable activities, irritability, low energy or fatigue, changes in weight or appetite, difficulty sleeping or an increased need for sleep, difficulty concentrating, low motivation, feeling of hopelessness or worthlessness, social withdrawal, and suicidal ideation. Effects: people with bipolar disorder have an increased risk for developing the following: thyroid disease, heart disease, chronic pain, diabetes, and obesity. People with bipolar disorder are also more likely to experience anxiety, substance use disorders, and post-traumatic stress disorder. Treatment: a combination of the following treatments may be used to treat bipolar disorder. Psychotherapy, which includes cognitive behavioral therapy. In this type of therapy, a healthcare professional can help one break their negative thought and behavioral patterns of depression or mania and adopt healthier ones instead. Interpersonal and social rhythm therapy. This type of therapy focuses on improving medication adherence, managing stressful events, and decrease disruptions in social rhythms and daily routines. Family-focused therapy. This type of therapy includes psychoeducation sessions and training to improve communication and problem-solving skills while joined by loved ones. Medication. A healthcare provider generally prescribes mood stabilizers, antidepressants, and antipsychotics. Electroconvulsive therapy. This involves a procedure in which a brief electric current is applied to the brain to induce a seizure and relieve symptoms. This treatment is used for people with severe depression, life-threatening mania, and when a person experiences no improvements with other types of treatment. Transcranial magnetic stimulation is a brain stimulation that sends magnetic waves to the brain instead of electric currents to relieve symptoms. Light therapy, which can help with depressive episodes in the winter. Ketamine treatment, which is an anesthetic provided at low doses with an IV to relieve depressive and suicidal symptoms. And hospitalization, which is used in emergencies when someone experiences a severe episode and are threats to themselves or other people. Coping strategies. Lifestyle changes can help prevent behaviors that exacerbate the symptoms of bipolar disorder. Some lifestyle changes are to quit alcohol and/or recreational drugs and tobacco, as they can interfere with medication and trigger an episode. Keep a mood chart or diary to track thoughts and feelings, track the efficacy of treatment, and recognize potential triggers of episodes. Have a healthy and regular sleep schedule, as changes in sleep frequency may trigger an episode. Exercise regularly to improve mood. Stick with treatments, take medication as directed, manage stress by eliminating unnecessary stressors, and spend time with family and friends who can provide support. Bipolar disorder is a lifelong mental health condition, but treatment can help one manage the symptoms. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.